This week on Empowering Midlife Wellness, I'm talking about bone health and what we can do to improve our bone density with hormones, exercise, supplements, and particularly focusing on strength training and how important that is not only for our muscles and general health, but also for our bone health. Hi friends, and welcome to this week's episode. If you're just joining me, I'm Dr. Susan. I'm a board-certified gynecologist and certified menopause practitioner dedicated 100% to taking care of women in midlife, in perimenopause, menopause, and beyond. Women like me who want to feel our best now and set up the healthiest older version of ourselves, because that's all about prevention. So today I want to talk about bone health, and I've made a video previously about osteoporosis, but with a slightly different angle today, really focusing on the importance of exercise. And by now, don't we know that exercise is really the prescription for just about everything? So in the context of bone health, let's just back up a little bit and remember how our bones function. Often we think about our bones like a skeleton, as if they're dead, but bones are very alive and thriving tissue, constantly remodeling and adapting to the environment. So we have several main types of bone cells. We've got the bone cells themselves, which are called osteocytes, and then we have the so-called bone builders, or osteoblasts, and then we have the ones that break down old bone called osteoclasts. And so those all need to be in balance. We're building new bone, turning those into more osteocytes. At the same time, those old ones are being cleaned up and regenerated. When our body needs calcium or magnesium, those are released from our bones, since our bones are the major reservoir for those two very important minerals. So there's a lot of action going on inside our bones. When we're young, up till about our mid-20s, we're developing more bone density as we get older. You know, kids have very kind of bundy, soft bones, almost like cartilage when they're little, and it turns into very solid bone as we get older. So in that state, we've got more work going on with the bone builders, those osteoblasts, and less of the breaker downers, so to speak. And then we enter a period of relative stability from our 20s up until around the time of menopause, and then it takes a major nosedive. The reason for this is that when we lose estrogen, or when our estradiol levels start to drop, even in perimenopause and certainly rapidly in menopause, estrogen is a very important hormone that stimulates the osteoblasts, and so without it, we get a reversal of what we want, where we've got bones being broken down more quickly than they're being built. And clearly that results in a very rapid drop in bone density. The importance of that, obviously, is it ultimately puts us at increased risk of fracture. And fracture is no joke. If we break a major bone, especially in our hip, patients who are over 70 and have a hip fracture have a 1 in 3 chance of dying in the first year. Not from the hip fracture itself, but from complications of being immobilized, like a blood clot or an infection that they might pick up in the hospital. Other things that happen are just being socially isolated. It increases our risk of dementia. So suffice to say, we don't want to break a hip. That leads to all kinds of downward spiral that we don't want. Instead, we want to prevent that from ever happening. And so prevention of bone loss is really, really important. Other places that we might get a fracture, of course, if we fall on an outstretched wrist, we're going to break our wrist. Well, we can survive that. But again, that limits our activities and can set up a downward spiral. Little fractures in our vertebrae and our spine cause us to lose height. We can get that hunched over appearance that's called kyphosis. And, that's cosmetically not great. We get shorter. Nobody wants that. But actually what's happening there also is that it changes our visual field so that we're more likely to trip and fall. So there's just a spiral of negative things that happen when we have bone loss. Those little old ladies who are hunched over are also very uncomfortable. It's not a comfortable position for our muscles. It limits a lot of activities. So let's just not go there. Now, if we've already got osteoporosis, I'm also going to talk about how some of these interventions that I'm about to mention can still benefit us. But of course, the number one plan is to keep our bone density as high as we can and not ever get osteoporosis in the first place. Okay, so what are bones made of? Well, I mentioned they're a reservoir for calcium and magnesium, so we've got to get calcium and magnesium in our diet to allow our bones to continue to remodel. And then vitamin D is critical because it allows calcium to be absorbed out of our intestine and into our system. So calcium, magnesium, vitamin D, also very important. Now, we don't necessarily need to supplement. I'm not going to talk so much about those today, but just to say they're important. Some little reminders that we need about 1,200 milligrams of calcium a day as menopausal women. Now, we can get all of that in our diet. We don't necessarily have to take a supplement at all. Dairy, obviously, and then lots of other sources of calcium. You can Google that one. Interestingly, some of them are the same green vegetables that are very high in magnesium. So if you're eating lots of broccoli, kale, other things like pumpkin seeds, chia seeds, lots of things that you might not expect are really high in calcium and magnesium. So best way to get those is with diet. And if we don't get them in our diet, then of course a supplement is important. Just a little side note on calcium supplementation, we cannot absorb more than about 300 milligrams at a time. So taking a giant calcium pill with more than that in it is not going to help your bones, but it will increase your risk of kidney stones. So if you take a calcium supplement, stick to something that's, say, 300 milligrams, and then preferentially get it in your diet. Vitamin D, we've talked about before, safe ranges to stay in on a blood test are, sort of 40 to 60. That's generally accepted, although there's lots of controversy about that. Let's just stick with that sensible approach. Okay, so we're getting what we need to support our bones, but the estrogen loss is causing those bone builders to not work as efficiently. So no matter how much we're getting in our system, we're not going to be able to build bone effectively without estrogen. And then secondarily, if we're becoming less active, activity directly affects the way our bones work, which is continually adapting to stress from the environment. So when we're young and we're doing a lot of running around, jumping up and down, playing soccer, kicking balls, jumping on our feet a lot, that pounding on the bones stresses the bones in a good way and increases the activity of the bone builder cells. And so activity that pumps on our bones with physical stress is a really good idea. So that would be things like jogging, which ironically doesn't provide that much stress for our bones, some type of jumping or pounding, if we're doing tennis or soccer or running around, pounding on our feet, you get the idea. These are things that we don't often think about doing when we're in our 50s, but how about tennis, pickleball? There's a lot of different ways that we can be pounding on our feet without causing injury. Now, things like swimming and cycling are really great for our heart, and we want to do those, walking, but they don't do nothing to stress our bones. So those particular activities are not going to be important for helping bone density. They will be really great for your heart and great for lots of other things, but we need to think about within the realm of what we can safely do, something that is pounding on our bones to keep them turning over. So two different things. There's the pounding activity, and then there's the muscle building activity. So we talk a lot about resistance training, and generally in the context of gaining more muscle for all of the amazing benefits that muscle provides. But of course, when we're using our muscles are attached to the bone with tendons, and that also pulls on the bone and stresses it. Now, that doesn't happen with 1 pound weights or little light water aerobics or anything of that nature. We're talking about heavy weights. So tons of science supporting no matter how old you are, so long as you're doing it safely and you've been trained to use proper technique, lifting heavy weights is really appropriate, even for women who have bone loss, even if you have a diagnosis of osteoporosis, and even if you're 80 years old. So this old idea that we are frail and we need to just do aqua aerobics or lift 1 pound weights and not do anything to break our bones is false. In fact, exercise reduces the risk that we'll break our bones, so long as we do it safely. Now, we're not recommending jumping out of parachutes or anything that is straight up dangerous, but it's safe exercises that you can do in the gym. Now, what kind of exercises are we talking about, and how heavy are we talking about? Well, I'm going to refer you to a really amazing study. Many of you might have heard of it. It's called Lift More. It's always great when studies have cute names. The Lift More study was actually published in 2017, and it came out of Australia, but it's a really amazing study. This particular group took 100 women, about 100 women, divided them randomly into 2 groups, One of the groups, now remember, these were women who had already had a diagnosis of bone loss. They already had osteopenia or osteoporosis based on a bone density test, and their average age was in the 60s, so they were well past menopause. Half of them were randomized to a group that did old lady exercises, like walking, stretching, some very light weights, things that we would expect that a woman in that group would typically do. And they were doing it twice a week for 30 minutes at a time for 8 months with a lot of supervision. So they did slowly ramp up the exercise, but that particular group never got too hard. They kept it pretty light, as we normally would expect an exercise program would be for an older patient. Now, the other half of the patients were randomly assigned to a group that did heavy weights. And I'm going to talk to you about how heavy, but really heavy. Of course, supervised by a physical therapist, and they were taught how to use appropriate form and all of those good things. But in 30 minutes twice a week, they did 4 exercises only. They did these 4 things. One was a squat with a bar on the back. The next was a deadlift, standard deadlift. The next was an overhead press. And the fourth one was a pull-up, supervised, with a drop down to the ground. So that had that pounding activity as the feet hit the ground. Now, the interesting thing about that is, of course, they ramped up over time as they got stronger. After they'd been trained to do these things safely, they did 5 sets of 5 exercises, so quite quick. So they were able to do 5 sets of those 4 exercises in 30 minutes. Now, if you're doing 5 of something and it's very heavy, that's quite difficult. So they were instructed that the weight would be such that it was about 80% of the maximum weight they could lift once. So imagine doing that 5 times, you're tired, and then 5 sets. So quite quick, and you wouldn't believe the weight that these ladies got up to. A lot of them were deadlifting their own body weight. So for someone like me, that would be doing, 125 pounds in a deadlift, which would be quite challenging for me at my age. But under supervision, these women were quite able to do that. And the interesting thing is, during that 8 months, none of them got injured. Nobody broke a bone. Remember, this included women who had osteoporosis already. No problems occurred. But at the end of the study, what was so amazing is that in the group that did the heavy weights, they saw several amazing findings. One that I love is they got taller. Now, it was only half a centimeter, but they got taller because their posterior back muscles got stronger, and so it was able to lift them out of that bent over position, even just a little bit. Now, remember, once you are more upright, your vision gets better, you're less likely to fall, you're less uncomfortable, you're able to do more things. So there are multiple benefits of strengthening your back. So they got taller. Of course, they gained muscle mass. Naturally, they lost some body fat. They got dramatically stronger across every exercise. And most importantly, they improved their bone density significantly. Now, this was only in 8 months, and we're often taught that you can't really improve your bone density. All you can do is stop it from declining. But in this group, they actually improved bone density significantly in a period of just a few months. Now, in the little old lady exercise group, nothing good happened. They lost height, they lost strength, they saw no improvement in their bone density. Actually, it declined even in 8 months. So this really goes to show that traditional old lady exercises are not only not beneficial, at least for the bones, but they actually allow us to keep declining in bone health. It also showed that even if we've got low bone density, we can still tolerate doing some pretty hard stuff safely. Now, of course, again, we need to do this in a supervised manner with a trainer, somebody who is professionally trained to show you the correct form. But in a safe environment, we do not have to be afraid that just because we're a certain age or just because we already have some bone loss, even osteoporosis, that we need to stop exercising. And this happens all the time. I had a patient just last week come in who told me that her physician had explained to her that because she had a diagnosis of osteoporosis, she needed to stop doing everything. Stop playing tennis, stop riding her bike, stop skiing. She needed to only do aqua aerobics, which was the worst advice ever. As you can imagine, that would just make her bone loss even worse. So we need to get out of that old environment of treating ourselves as being so fragile and recognizing we actually can do hard stuff, and that is one of the most important ways that we can improve our bone density. So a really great idea is when we are around 50 or earlier if we start going through menopause earlier, to get a baseline bone density test. That's called a DEXA scan. We see where we're starting from. And we can pick up those who already have some decreased bone density and really get busy about making sure that we address it early. The other thing we want to do is start on estrogen immediately, because any short period of time without estrogen is going to accelerate bone loss. So if we can, that's another of the many reasons to start on estrogen right away. And just a little word for testosterone too. We know, of course, testosterone also has a beneficial effect for the bone. So starting on those as early as we can, getting a baseline bone density test, making sure our calcium, magnesium, vitamin D are adequate, and then doing some heavy stuff, lift some heavy weights and some jumping. Now, just a quick word on how to interpret your bone density test when you do get it done. There's several scores that are reported, and the one that we generally go straight to is called a T-score. So a T-score is based on the idea that at some point we had perfect bone density for the imaginary average 20-year-old, let's say. So I don't know if my bone density was ever that good, but we have to start somewhere. So a T-score of 0 would indicate that your bone density is identical to an average healthy woman in her 20s. So as we age, everybody's going to have a slightly lower than 0 T-score. So it's quite normal to have a T-score of less than 0. In fact, it would be very unusual not to have one that's slightly less than 0. When it gets down to -1, we consider that to be osteopenia. So anywhere from 0 to -1 we consider to be normal. At -1, we call it osteopenia, all the way down to -2.5. Now, it's not that something terrible happens when you cross the 2.5 threshold, but that's what's been decided as the diagnosis of osteoporosis. And it's simply a nod to the fact that at that point, our risk of fracture starts to get high enough to pay attention. Osteopenia also needs to be paid attention to, because even though the risk of fracture is much lower, we want to intervene early and not wait for it to get worse. So just like everything in wellness medicine, we don't want to wait till you have osteoporosis. We want to prevent you from getting osteoporosis. So when you get a bone density test, we go straight and look at that T-score. You're going to get several different T-scores. You'll get one for your hips on each side, and you'll also get one for several areas of your spine. The tradition is to diagnose osteopenia or osteoporosis based on the worst area. So for example, in my case, I have normal bone density everywhere, except I have a slight osteopenia in some of the vertebrae in my spine, but it's mild and it's actually getting better. Now that just speaks to the fact that we can improve bone density. Like I mentioned, we used to think that the best we could do is keep it stable, but we actually can see that our T-score can improve. Now it did in these ladies in the Liftmore study, it has in me, and it has in many of our patients who are following this very safe and healthy protocol. So I'm not even going to talk to you today about bone builder drugs. They are out there, and sometimes we have to resort to medications if all else has failed. And that would almost always be in the case where we have not treated the problem early. So if we treat it early, we would hope that we would rarely need to use bone builder drugs, because there is not one single drug on the market that works nearly as well as estrogen, calcium, vitamin D, magnesium, and exercise. So let's do those things first. Now, just a word, if your doctor has told you that you don't need a bone density test until you are 65, they are actually following what's considered to be the standard recommendation there, which is crazy. Please don't wait till you're 65. It's a really easy test to do. It's painless. It's almost zero radiation. It takes about 5 minutes. It's inexpensive. We want to do that as soon as you start entering the menopausal transition so we can see where you started. The current recommendation starting at 65 is just that old nonsense that we want to wait until you get sick before we do anything about it, and that just doesn't make any sense in the realm of wellness medicine. So please don't wait till you're 65. Now, if you didn't get this advice and you're already 65, we can start where we are. Don't worry. We can start doing almost all of these things no matter how old you are. Because remember, the patients in the Liftmore study were all in their 60s or older, and they all already had significant bone loss, and they did really well on that protocol, so you can too. So if you'd like us to help you put together an exercise plan along with a nutrition and hormone plan to maximize your bone density, we are seeing patients in person in Houston and also remotely, so check us out at the website below. If you enjoyed this episode, please don't forget to share it with your friends, and I can't wait to see you next week.